Rhonda, is this light over my shoulder bothersome?
No, it's fine.
Okay.
That's fine.
You know, my office gets sun for about 20 minutes a day, and it's in like this 8:45 to 9 o'clock stretch. Then, oh, you people over in Phillips Wagenstein just steal it from me.
Okay, great. Well, welcome to the 2022 Health Disparities Roundtable, and thank you all for taking time to be here. I'm Rhonda Jones-Webb, professor in the Division of Epidemiology and Community Health at the University of Minnesota School of Public Health. I serve as co-chair of the Health Equity Work Group, along with Dr. Kathleen Call. This roundtable is one of the most enduring events in the School of Public Health that it offers the public health community and the public in general, coming on close to 2 decades. It is my pleasure to open this Health Disparities Roundtable with the timely topic of climate change and public health. It is definitely a topic on the public's mind across the planet. Climate change is impacting human life, and it threatens the essential ingredients for good health: clean air, safe drinking water, nutritious food, and safe shelter. Climate change disproportionately affects communities of color, Indigenous communities, and those living in poverty. Today, we will seek to better understand the effects of climate change on health disparities locally, nationally, and globally, while also highlighting sustainable interventions and strategies to counter health inequities created by climate change. As we begin today's event, we acknowledge that we are located on Dakota land. We recognize the vast amount of Indigenous knowledge that this land has seen and encourage everyone to be respectful of the distinctive and permanent relationship that exists between the Dakota people and their traditional territories. We'd also like to pay respect to the elders, both present and past, to allow us to be here today. Lastly, I want to thank everyone that made this year's roundtable possible. This includes the School of Public Health's Health Equity Work Group, Center for Leadership Education in Maternal and Child Public Health, the Dean's Office, and the Student Senate, the University of Minnesota School of Program and Health Disparities Research, the University of Minnesota Institute on the Environment, and the University of Minnesota Humphrey School of Public Affairs. Finally, I want to thank the Health Disparities Roundtable committee members for all your hard work. Now I'm pleased to turn it over to today's moderator, Dr. Jessie Berman, who's an assistant professor in the Division of Environmental Health Sciences here at the University of Minnesota School of Public Health. Thank you.
Thank you, Dr. Jones-Webb, for that introduction. It's really my privilege to be here to help moderate this session. We have 3 fantastic speakers who are going to speak today and give their perspective on climate change, the work that they're doing, and really understanding the public health impacts of it and how we can take action. Today's session will work by, we'll give a brief introduction, and each of our speakers will have a chance to talk, and then that'll be followed by an open roundtable discussion with questions from you in the audience. So with that, I would like to introduce our first speaker, who is Melanie Montano. Melanie is an enrolled member of the Red Cliff Band of the Lake Superior Chippewa Red Cliff Tribe, and she's also a traditional ecological knowledge outreach specialist for the Great Lakes Indian Fish and Wildlife Commission. As a traditional ecological knowledge specialist, Melanie collaborates with Western scientists to assess the impacts of climate change on treaty resources and identify potential threats to the Ojibwe culture and lifeways using interviews from tribal knowledge holders. Prior to joining the Great Lakes Indian Fish and Wildlife Commission, she was the environmental programs manager for the Red Cliff Tribe, where she managed various environmental programs, including the Native American Lands Environmental Mitigation Program. She served a 2-year term as one of the 2 tribal representatives for Wisconsin on EPA's Regional Tribal Operations Committee, and she served as first a secretary and then later as a chairperson for the Red Cliff Tribal Police Commission and on other various committees such as the Alliance for Sustainability, the Treaty Natural Resources Committee, the Integrated Resources Management Plan Committee, and others. In October of 2020, she began serving a 4-year term as one of 3 state of Wisconsin government-appointed members on the Great Lakes Compact Commission. She holds a BS degree in healthcare administration with a dual emphasis on Native American environmental studies. And lastly, and most importantly, she has been and will continue to be a lifelong student of our cultural ways.
Miigwech for that. Wuju Bevami Kami Kukwe and Dijinikas, Miskwabe Kang and Dunjiba, Megazien Dodame. As Jesse said, Melanie Montano, I'm a member of the Red Cliff Band of Lake Superior, Ojibwe at the very top of Wisconsin. And that's actually where I'm calling in from for the Zoom here. But I tend to travel to the cities quite often, so I know those lands as well. And I just want to start out by talking a little bit about identity, but also land acknowledgement before we start talking about climate change. And the reason being is because it's always interesting to hear the different things that I've done, because I just kind of do stuff, mostly because I just have an interest and a passion for and hope to help make changes and things like that. And so those things that I do aren't necessarily about the titles, and that doesn't, make up who I am, but who I am more so comes from the land around me and what I've learned from the land and how I've learned how to survive, how to hunt, fish, gather, all those kind of things. And it's from that as my foundation that I, end up being connected with different natural resource committees and climate change work and things like that. And that brings me to land acknowledgement. I want to say miigwech, or thank you, for including land acknowledgement. It's real interesting these days, especially in the times of Zoom, when a lot of people are moving towards that, doing land acknowledgements, and it's definitely respectful and proper and with great intentions. But I kind of want to touch on the importance of that, besides land acknowledgements just being words and talking about who is from that area, wherever, you're holding a conference or different things like that. Because with land acknowledgement, when you go deeper, it's actually about acknowledging the land itself as well, because at least in the Anishinaabe culture, we believe that humans were the last ones put on earth. And so, of course, before us, there was the land, and without the land, we wouldn't even be here. And so we're real dependent on that. And so when it comes to the land, we have to make sure that when we do land acknowledgements, we really are intentional, even in our thoughts, not just our words, but our thoughts about what the land is around us, where we're residing at that time, and what it has to offer us, what it's gifting us, how it's helping us survive, and who are the people from that area, the history of that land itself. So not just, the indigenous people that resided there, because really at the end of the day, we're all indigenous to somewhere, wherever we came from. And so with that, we have a direct connection to those areas. And so once we get to know the land around us, then we can actually start to understand more about ourselves, because our identity comes from there. Even those people that are raised in cities, that's the land around them, the concrete buildings, things like that, but that's therefore a part of their identity. So when you think about land acknowledgements from, a conference perspective, wherever they're addressing things like, say, the Twin Cities, in this case, also think about where you come from and your roots come from, where your people may have traveled through and things like that, because all those things really are a part of your genetic ancestry, but they're also a part of your genetic memories. And so once you get to know that, once you start thinking about the land around you and the land where you come from, and really appreciating and respecting that and thinking about the gifts that it has to offer, that will in turn help you to be a much healthier person. And the reason I say that is because, again, we wouldn't be here if it weren't, for the land and the foods that it offers us, the space, the being able to build homes, all those type of things. And so at the end of the day, we definitely wouldn't have, be surviving. So we wouldn't obviously be healthy. But the land around us brings different health components besides, thinking about it that from that aspect, but there's mental health related to the land, there's emotional health, there's physical health, all those type of things. And so in turn that, of course, connects to climate change. As we're seeing an increase in climate change impacts nowadays, we're of course seeing a lot of changes to the land around us, and that in turn is really rocking or shaking our healthy way of being, our ability to survive even at times, especially during these times of COVID, when we're not able to be in contact with each other, but we can actually go out into the forest and be in that quiet space and take in the healing from the medicines that are there, or simply just being present. I know here we're being hit with a huge snowstorm, and the snow is completely melting, and now it's just, I have to say, it's a last snowstorm, I'm guessing, but it's completely beautiful. So when you think about going out there and having the snow falling around you and just like pulling down on the trees and things like that, that can bring inner peace in itself and, help people to feel a lot healthier. But of course, again, in that the times of climate change, all that is shifting around us. We're losing so many gifts that were given to us in our different regions. I know one thing for us as Ojibwe people that we're real sensitive to is our dependency on wild rice or manoomin. But of course, climate change we know is heavily impacting manoomin, and that's one of the most vulnerable beings. And so if we essentially lose wild rice, we're not able to eat that for nutrition. We're not able to have it as part of our culture, our identity, and all of that kind of shifts. And once we start losing all those different pieces, we start losing the health of our entire beings. And so with that in mind, I just want to say a little bit about the organization that I work for as well currently, which is the Great Lakes Indian Fish and Wildlife Commission, as was mentioned. And I'm in the climate change program, which is under the Division of Intergovernmental Affairs. And in the climate change program, we have a few climate scientists and then myself, which focuses more on the Indigenous knowledge component. And as it was said, I work with the scientists who are coming at things from a Western perspective. And collectively, we look at how climate change is impacting the lands, the resources, but also our people as Ojibwe people in this region. Glyphwick works for 11 member tribes throughout Wisconsin, Michigan, and Minnesota. So that's the wide range of area that we're looking at when we're thinking about those climate change impacts. And one of the biggest reasons we're doing that is not so much just because climate change exists and climate change is a concern, and many beings are vulnerable to climate change, but also the fact that as, Anishinaabe people or Ojibwe people, we're extremely dependent on those ones around us, the trees, the fish, the water, and all those ones in order to be able to survive. It's our complete lifeways, our lifeblood. A lot of our people on a regular basis do all the different seasonal activities. Like right now, for example, is the time for sugar bush. We spend a lot of time in the sugar maples, and some families actually set up camps and they stay there a few weeks and tap trees and produce maple syrup and maple sugar and use it as a time for storytelling, which again is happening right now. But when you think about climate change, again, those are one of those things. As that shifts, our families will no longer have those spaces to be able to carry out those activities, to be able to feed that maple syrup to our kids, and they may not remember what it is at some point down the line. And so with the climate change program at Glyphwick, the type of activities we're doing is we're working eventually towards a climate change adaptation plan, which will hopefully help our tribes understand different ways they can, or different routes they can take in order to adapt to climate change. because we are more impacted than a lot of other groups of people. But also in getting to that point, we have a phenology study where our scientists are going out and looking at the seasonal changes that are going on. Say, for example, when leaks are coming up, and sometimes the time of the leaks coming up may actually change. And also looking at like ice thickness and ice out and when that happens and how all those things kind of shift and flow throughout time, and also how they're all interrelated. And so we have the phenology program, but then we also are currently finishing up our second version of a vulnerability assessment. Our first version is out there and can be accessed through GlyphWIC's website. But the second version, we have a lot more species in. And so we're mostly focused on just the vulnerability of certain species in our region and how they're vulnerable to climate change. And so the ways we're going about that is our scientists, the Western ones, are looking at the whole scientific perspective and running a tool to actually look at how they're vulnerable and things throughout time. And then on my part, I'm going and interviewing our knowledge holders, elders, harvesters, gatherers about changes in the environment over time and what they feel is more vulnerable. And again, wild rice is one of those great examples, because through a Western lens, wild rice is considered to be one of the most vulnerable species out of our entire list to climate change. And it, not by surprise, has matched up with what our elders and our harvesters and those have been saying, that yes, wild rice is one of the most vulnerable ones to our people, or for our people, to climate change. And so when you think about that, not everybody knows, but quite a few people know that wild rice is actually part of our story as Ojibwe people. When we basically traveled to this area from out east, one of the things that we were doing was going kind of based on a prophecy or teachings that were given to us and dreams and things. And so we were traveling to the area where food grows on water. And so that's directly, completely a part of our identity and what brought us to this region. And the food that grows on water is wild rice. And so we knew that would be our stopping point when we arrived and saw the food that grows on water. And, here we are today, knowing that climate change is coming on and we may actually lose that throughout some point in time. And so if we lose that, we lose our ability to stay healthy and lose our identity. So with GlyphWIC, the vulnerability assessment and phenology study will be going into that climate change adaptation plan. But I also want to briefly mention a tool that a lot of us, not just with GlyphWIC, but other organizations and individuals have collectively worked on. It's called the Tribal Adaptation Menu. And basically the Forest Service and a group called NIAX has different climate change adaptation tools that they work with people on, and they carry out workshops to teach them how to use those tools. And it's for all groups of people. It doesn't have to be just natural resource. It doesn't have to be certain age groups or anything like that. And so those tools are extremely useful. And a group of us went to one of those trainings to understand how to use those tools, and they have them for different type of ecosystems and things. And one thing that we learned with the tool was that it didn't look at the climate change impacts through a cultural type lens, and it didn't incorporate climate change or cultural tools into working with climate change. And so it was kind of suggested, like, well, what would you all look at having then? And so we talked about having a different tool and workshops and things to be able to train people, whoever is working with Indigenous people or on Indigenous lands or making decisions with Indigenous lands, help those people to be able to help others to adapt to climate change, but with those cultural considerations in mind. And so that's how a group of us collectively came together and developed the Tribal Adaptation Menu, which now serves as the tool that has that cultural lens to it. And we do a series of, we do a workshop on it, and we've kind of moved them around the place based on need. And we recently hired a Tribal Adaptation Menu coordinator who is going to help facilitate a lot of that work moving forward, and the workshops, which actually happens to be my son, who is graduating with his bachelor's from Northern Michigan the end of this month. But that tool is one of our, I would say, most successful and beneficial tools that we have in working with, the quickly shifting climate that's around us and all those potential impacts that are out there. And I say it's successful not only because we've gotten a lot of positive feedback on it, but also because it looks at those cultural concerns and it considers them, whereas those other tools don't. And so for us, any steps forward that we make in looking at climate change or trying to adapt to, or some people, understandably so, want to resist climate change, we always try to keep the culture in mind and the impacts to the culture and how that may in turn impact our Indigenous people in this region. And really at the end of the day, we know that that's directly connected to the health of our entire being, again, our identity, our culture, and all of that. And so I just want to kind of bring it back around to land acknowledgement. And when we talk about land acknowledgement, again, it's not just those words, but it's all about all those different layers on how we're connected to the lands and how climate change is really impacting those lands and what it really means to talk about acknowledging the land and where you are and where you come from and things. So with that, I think I might be roughly at my 10 minutes. So I want to give a chance to shift over, but I want to say miigwech. Thank you.
Great. Thank you very much, Melanie, for that introduction. So our next speaker that we'd like to introduce is Niranjali Amerasinghe. And Niranjali is the Executive Director of ActionAid USA, where she's responsible for overall management and leadership of the US office, engagement with the Global Federation, and leading the fight to end poverty and injustice. Prior to joining ActionAid, Niranjali was the Senior Associate of the World Resources Institute and led the Finance Center's policy work on international climate finance and the Green Climate Fund. She also directed the Climate and Energy Program at the Center for International Environmental Law, or SEAL. Niranjali has worked at the intersection of climate change and human rights and has extensive experience with international climate negotiations, forest governance, and accountability. She also helped develop legal strategies to shift finance away from fossil fuel investments. Niranjali has an LLM in International and Comparative Law from the George Washington University Law School and an LLB from the University of Bristol. Thank you very much, Niranjali.
Thank you, Jesse, and thank you to everyone here for the opportunity to hold space with you and talk about these important topics. And thank you, Melanie, for that fantastic introduction from a community perspective. What I'm going to focus on is connecting some of the experiences in the work that ActionAid as a federation has been doing with communities across different national contexts. So I just want to be clear that what I'm going to highlight, the reflections that I have, are picking at some of the common themes that we see, but that obviously community contexts are different and far more nuanced and detailed than some of what I'm going to talk about. And I just want to echo what Melanie was saying about the right to self-determination for communities and the importance of making sure that both our understanding and assessments of what's happening on the ground, as well as the solutions, are informed by communities, and that these more general reflections are helpful in understanding common threads that we might see across national contexts. So the first thing I'll say is there are a number of different ways that we see climate change impacting people and communities. One is that climate change can bring a lot of new threats where they did not necessarily exist before, whether you're talking about things like sea level rise that's going to wipe out an entire habitat, that may result in the need to relocate, or because changes in weather patterns will render an area that was once fertile no longer fertile. And so there are these new things that people are going to have to deal with. Some of those are going to bring new health issues for communities that have not dealt with a particular type of disease or a particular type of change in environment that might result in other health impacts. But there's also the cultural and emotional health that Melanie was talking about that can be dramatic when those kinds of changes appear. And those are things that I would classify as newer things that climate change brings. But a lot of what climate change brings, and this also connects with what Melanie is saying, is actually making existing challenges even worse, or making existing things harder to deal with. We talk about it in the climate community as a threat amplifier. And I'll give you an example where people are already vulnerable because of poverty, because of like inequality for a range of reasons, whether it's race, class, gender, and other kinds of marginalization. Climate shocks, climate impacts can make that situation worse. An example that really struck me when I was first working in the field was a dialogue with farmers, livestock farmers, who essentially, like, their paycheck essentially comes from like one harvest cycle to another with their livestock. So if you have a climate shock, whether it's a natural disaster or excess flooding or drought, which means that there are no crops to feed their livestock, in order for them to survive, to access nutrition, to get nutrition, food, what they end up having to do if there's no cash transfer or other kind of social protection is they have to end up selling their livestock, right? Which was their only asset, or they have to sell their land, and that could have been their only other asset. And that makes them even more vulnerable then when additional shocks pile onto that. And then when you think about access to healthcare, right? If someone gets sick in that community, it reinforces that cycle of poverty and marginalization. And that's one of the big things we see in communities that are already vulnerable from a social standpoint. The impacts of climate change are disproportionate. So whether we're talking about indigenous communities, poorer communities, women and children, we see this across the globe. Whether we're talking about a developing country or a developed country, the fact that the impact the climate impacts have a far more disproportionate impact on those communities. And part of what, if we're kind of flipping to the conversation about the solution side of it, that disproportionate impact has to be recognized, because the solutions then need to address the fact that there are these disproportionate impacts. And one of the things that has concerned me significantly in the work that we do at a global level on climate change is that there's often a lack of understanding of that existing systemic challenge for communities. And people will sometimes come in thinking, oh, well, we just have to solve the environmental side of the climate problem, not recognizing that these underlying social issues that people have already been grappling with are a key part of having an equitable and just response to climate change. And there's different ways we think about justice, but I'm going to just focus on that part for the moment, because that's the most relevant from a climate and health standpoint. That if you truly want to address climate change in a way that will benefit the communities that are impacted most, it requires a rethinking of the systemic issues at play, right? And the systems we have created, because those systems in a wide variety of forms have led to the kind of vulnerability and marginalization that most of the communities we work with have seen. Now, on the solution side, as I pivot to that, I'll start with community-led responses and then work up to a more kind of macro reflection from the work. A lot of the work that ActionAid has done has focused on the grassroots side of things. Our theory of change is that we need to shift power to the communities that are most impacted by whatever challenge they might be facing. And those without power, we need to build their power and then connect them with decision-making systems from local to national to regional to international. And we play a role in supporting that process with the hope that ideally we could leave, right? Ideally, if we've helped change the power dynamics, if we've helped work alongside communities to build their power, then they will have access to decision makers directly and be able to advocate for the things that they need. And I'll talk about two different arenas where we've worked on this. One is on the climate and agriculture side of things, where there are projects that we have worked on with women farmers. We have a focus on women in the Federation, on women farmers to speak with decision makers about the kind of support they need. And part of where the disconnect has come from for them is that the government, the central government, doesn't have a deep understanding of the issues that women farmers face. And so their solutions to agricultural challenges for smallholder farmers is, we'll give you a credit line from a bank. Most of these women don't even have bank accounts. They don't have deeds to property. They don't have a means of even getting a credit line to begin with. That's not an appropriate solution. But when they were able to connect better with decision makers and say, these are the things we need cash transfers, we need seed banks, then that creates a more meaningful response. And it also means that when the government decides to invest more in agriculture, then they're getting the kinds of solutions that they need. And over a 10-year span, we really saw some gains in this area. And obviously there's a climate dimension to this because they're also dealing with climate impacts and the effect on agricultural cycles. And so being able to reflect on what they're seeing in their communities and connect it with data that governments are seeing from what they're collecting, that can be really powerful. On the health side of things, and I'll talk about the COVID example here, we saw the power of women-led responses to the COVID crisis before governments could get food and health services and vaccines out to people. And there's a lot of disparity in the global South, but then also communities within the global South, between elites within developing countries. The women organized responses were really powerful. And one of the reasons, and this is a personal reflection from the work that I saw, is that there was a massive uptick on gender-based violence during the pandemic with people locked down. And using women's centers that had already been created to address gender-based violence as a organizing point was powerful, not only because it got women out of their homes and organizing to deal with the health crisis, but also because it then helped address the health crisis in whatever way that they could in those communities. And I'm convinced that in the space where climate and health intersect, the power of community responses, and particularly women-led responses, is real. And it's something that we should be more focused on. The last thing I want to point out, and we can get into more of this in the questions if you want, is a reflection of the political and economic governance systems that we operate in, because they have, obviously it sort of has different effects on the healthcare system versus climate, but there are some common themes that I've seen in the work that we've done, because if you're looking at things from a systemic level, whether it's the individual within the system or governments operating in a global system, the kinds of economic governance that have been promoted in the world are not working for their people. And it in many situations is one of the contributing factors to the systemic inequality that we see in many developing countries, and then for developing countries globally as well. So I think we are at this moment, and we have been for a few years, between COVID and debt crises and the climate crisis, there's this opportunity to rethink the neoliberal economic system that so many have at least from a developing country standpoint, we have had to employ in order to get the kind of assistance, loans, and other things to be able to provide public services in developing countries. And the individual side of this is that when you're working within an economic system where healthcare as a human right even is not being realized, and people have to make decisions. I mean, even in the United States, you have to decide, like, if you don't have insurance, you're going to have to ask yourself, well, am I going to go to the hospital and rack up this massive medical bill or not, right? Or your government healthcare services may not reach rural communities when that system isn't present. That's a massive challenge for the individual and for the community they operate in. But then for governments, if we're talking about the public sector and how the public sector can support health services and address climate change, what many developing countries end up in is a situation where they already have debt. And in order to deal with a crisis like COVID, yes, there's some humanitarian aid. Yes, there's some grant financing, but the vast majority of capital out there is debt. And they don't have the sovereign guarantees in order to access more debt. If they do get debt relief, they have to use it to pay off existing debt. And they never get into that place where they have enough fiscal space to actually invest in public services. So I want to point that out because we forget that sometimes. We talk about health, we talk about climate, but understanding the backdrop of the political, economic governance systems we operate in is in my view, core to long-lasting solutions in both of these spaces. I will stop there and turn over to Jesse. Thank you.
Thank you very much, Niranjali, for that great introduction. Just as a reminder to all of our guests here, if you have any questions that you would like to pose now as our speakers are talking, feel free to enter them into the chat, and we will try to get to as many of them as we can throughout our session. So with that, I'd like to introduce our third speaker, Hyun Kim. Dr. Hyun Kim is an associate professor at the Division of Environmental Health Sciences at the School of Public Health here at the University of Minnesota. And Dr. Kim specializes in occupational health, disaster epidemiology, and climate change adaptation for health. And since 2017, he's been working very closely with the World Health Organization headquarters, as well as the Western Pacific region. During his time with the WHO, he's led various climate change and disaster-related projects, including 4 country-level Green Climate Fund proposal, development for health system resilience building in Mongolia, the People's Democratic Republic of Laos, in the Philippines, and Vietnam. In 2021, by working at the WHO headquarters as a full-time consulting scientist, Dr. Kim coordinated the global implementation of climate-informed early warning and response systems for infectious diseases in 10 different countries. He continues to work on international climate change adaptation building and recently initiated a new project to support North Korea's climate change adaptation and building in the health sector.
Thank you. Thank you for the introduction. I had the exactly same, I had a talk last night for the exactly same topic, and I introduced a lot of my field work, the actual experience in different countries. But today I was thinking maybe recycle that presentation, but it's probably better to introduce some more technical and academic approach that WHO developed, and we try to the tool we try to apply to understand the vulnerability and adaptation capacity of the countries. So let me introduce about the WHO's approach on vulnerability and adaptation capacity assessment. I have a slide to share. Okay. Do you see my slide? Okay. So this is WHO approach. So let me start from some background of climate change health impact. So climate change can affect health through the following pathways: changes in the frequency and intensity of extreme weather and climate events, such as heat, windstorms, flooding, and drought, and effects mediated through natural systems, such as changes in geographical range and instance of infectious disease like water and foodborne and vector-borne diseases, or health outcomes associated with poor air quality, like a high concentration of ozone and particulate matters and dust, wildfire smoke, and allergens. And also effects heavily mediated by human system, like occupational impact, undernutrition, conflict, migration, mental stress. So changes in the mean and variance of climate variables can independently and also jointly influence the burden of climate-sensitive health outcomes. For example, rising temperatures can create conditions conducive to the geographical spread of vector-borne diseases, such as malaria and dengue. Heavy rainfall sometimes can wash away the breeding grounds, so resulting in short-term reduction of the number of mosquitoes in endemic area, which is good, but can also provide mosquito breeding habitats in places where mosquitoes and those vector-borne diseases were previously uncommon, and increasing diseases in populations that have not previously been exposed and have low immunity. These changes are dynamic and complex, and also can lead an unanticipated health risks for geographical regions and populations. As changes continue and with shifts in the key determinants of health, population health status, and population aging and health system capacity, thresholds may be crossed that could result in large increases or decreases in the incidence of climate-sensitive health outcomes. Many impacts on human health and health systems from climate change can be reduced or avoided through well-designed adaptation measures. So this is our goal, adaptation. Nevertheless, health risks of climate change will continue to be disrupted inadequately with sensitivity population and regions affected differently. Some population groups, as Melanie and Niranjali mentioned, they will experience disproportionate impacts because of a heightened physiological sensitivity and greater exposure or less capacity to take protective action. So next slide. So we understand, the health impact is not, it is really disproportionate to population. That's the vulnerability of the population. So WHO has developed a specific tool, which is called Vulnerability and Adaptation Assessment, to understand the health vulnerability and adaptation capacities. So this guidance, so they don't really make a tool to enforce the people to use, but they make the recommendation and guidance so it can, people can use that flexibly. So this guidance on conducting a national or subnational VNA assessment of current and future vulnerabilities to the health risks of climate change, and the policies and programs and capacity of the health systems that could increase resilience by considering the multiple determinants of the climate-sensitive health outcomes. The assessment outcome provides information required by decision makers for the effective management of the health risks from climate change, such as the magnitude and pattern of health risks attributable to climate change, and potentially severe impacts to individual health and to health systems when capacity to respond is overwhelmed. And opportunities to collaborate with decision makers outside the health sector. This is very important these days. We talk about co-benefit, not just health sector, but also other sectors to work together to co-benefit each other. So so to achieve large health benefits from climate action, and potential cost savings and other benefits of implementing such policies and programs. So this VNA assessment helps building capacity within and also outside of the health sector to prepare for and identify changing risks, and to evaluate the effectiveness of ongoing and proposed policies and programs. This contributes to the generation of knowledge in understanding the health impacts of climate change and developing approaches and options for action. So this is specific steps of vulnerability assessment, VNA assessment. This is very similar process for all nations and regions. It's, again, this is just the guidance, not the specific tool for a certain group or enforced to the country to use. The goal remains to better understand how climate change can affect health and increase to better inform policies and programs that can protect public health. All policies and programs identified to protect health through this VNA assessment process need to consider the evolving social, economic, and environmental and political context within which they will be implemented. And local policymaking processes and institutions and available resources will influence the choices of which policies and programs to implement to address the health risks from the climate change. For example, some communities and nations have vector-borne disease surveillance systems that legally require individuals to clean up vector breeding sites within their living areas. But most of nations do not have this option for improving vector control. So we cannot really just apply the common approach to everywhere. And the ability of a nation or community to identify and implement effective adaptation policies and programs depends on a range of factors. Policymakers and the public must have sufficient knowledge of the health risks from climate change and the range of responses needed to reduce adverse health impact. Once there is a motivation for action, policymakers need to know the magnitude of potential risks and identify a range of adaptation options, including their feasibility, benefits, acceptability, and effectiveness and cost. The ability of resources and their distribution across the population and the structure of critical institutions, including allocation of decision-making authority. A carefully conducted assessment can be a major contribution to protecting people from climate change. Managing the health risks of climate change involves an iterative management process. It starts with assessing the current and likely future vulnerability of the target community or geographical region, and qualitative and quantitative estimating the extent of future health burdens due to climate change, and designing and implementing policies, programs to reduce risks due to climate change, and then monitoring and evaluation these policies and programs to identify necessary modification. So this is a cycle of the process, what we do to improve the resiliency through this VNA assessment. And also, this is very important too, stakeholders' engagement is integral to the process. At each step, there are opportunities to communicate findings to and learn from stakeholders, policymakers, researchers, and the public to enhance the understanding of the health risks and impacts from climate change, and other adaptation policies and programs to address them. The risks of climate change provide an opportunity and a challenge to health sector to demonstrate leadership within and outside the sector on adaptation and mitigation strategies. And maximizing this this opportunity is with the other sector in designing climate resilient pathways would bring a great opportunities. So the important thing is climate change adaptation is really the health sector part. There are two types. One is mitigation, which is the reducing the greenhouse gases production. That has been the main activity related to climate change. But now we are moving on to adaptation part, and health sector should be the main group. However, it's been very slow. And within the GCF, Niranjali mentioned the GCF too. GCF is the largest funding mechanism under United Nations for climate change action. And we have only one project approved recently. That's all for the health sector. All others, those are different areas, and mostly for mitigations like renewable energy, because those are also business too. So this is what WHO's approach to assess the vulnerability, and also identifying the adaptation capacity to improve. And the overall goal is the resilience building. So the community or nation, when they have the hazard from the climate change risks, they can stand from the impact. That's all of my presentation.
Great, thank you for all three of our speakers. Those are really interesting talks, specifically about the work that you're focusing on right now. So we're going to transition right now to the open Q&A discussion session. So once again, for audience members, feel free to write your questions into the chat, and we'll try to get to as many of them as we can. I think that Dr. Kim's comments about adaptation is a perfect segue into our first question, which is really for all three of you to potentially answer. So one of our participants wrote, "So much climate change has already occurred. What does a public health agenda look like for adaptation?" So I was hoping that each of the three speakers could maybe just give a quick single example as to how you believe that public health agenda looks like for adaptation. So I guess, Niranjali, would you mind kicking it off?
Oh, sure. It's a tough question because so much needs to go into it. But I'll say that the starting point is the assessment, right? There has to be, whatever the vulnerability assessment that a country is doing, there needs to be there's multiple sectors you need to think about, right? And health has to be part of that. So it starts from an understanding of what, based on the impacts you're currently seeing and what is projected 5 years out, 10 years out, 20 years out, what does the landscape look like? And then the sort of the health climate intersection. And you do need to think about agriculture and livelihood, like all of those other things, because they all matter, right? It's got to be like an interagency, multi-sectoral undertaking. And when you have whatever data, you take whatever data you have and you can map out, here's what we think is coming, then you can go deeper into the stakeholder consultations and understanding on a local, regional, and national level, what are the potential options that might be on the table. And I'm talking in very, very broad terms. Some of those things could be that there need to be changes in agricultural practices. Farmers might need to think about transitioning from one type of crop to another. There might need to be intra-country migration that needs to take place because of loss of habitat. For some countries, the adaptation agenda might involve having to relocate to other parts of the world, right? That's the reality for some of the island nations. So then what does that look like? And what does the health component of that look like, right? If you're moving an entire population to another place. And the other part of it that honestly, I would love to hear Melanie's thoughts on this, is the cultural dimension, right? If you're looking at the cultural health and emotional health side of things, given that there are parts of people's livelihoods, land that we're just going to lose. Because of the climate change that's locked in, how do you navigate that, right? What does that agenda look like? So I think it's important that the health agenda isn't just about the sort of physical health, like a narrow determined interpretation of physical health. We also have to look at that because that also creates generational trauma, right? And so thinking about that side of things is also important. I know that's not a single concrete example, but I'm just kind of thinking from a public policy standpoint, what are all the different dimensions you might need to think about?
Great, thank you, Niranjali. And actually, Melanie, another participant, had a second question asking how your organization incorporates a cultural lens into your assessments of climate change. So would you mind speaking a little bit about that?
Sure. Yeah, it's been an interesting process because even though our organization initially was formed, because of looking at treaty rights for the Ojibwe people and everything, a lot of our strengths were in the Western scientific aspect. And so we brought on a lot of biologists and things like that, looking at those things. And again, even though our, being of our indigenous ways and life ways and stuff like that is rooted in culture. But it wasn't until recently, maybe the last 5 or 8 years or so, that we've been looking more at indigenous knowledge and culture and integrating that into management plans, assessments, things like that. And so one way we've been doing it is basically going back to, I guess I struggle, I have to be honest, I struggle with the term stakeholders. So for us with Cliffwick, we don't have stakeholders. We have, you know, our people that we work with, our relatives, our communities and things like that. And so we basically go right back to them to try to figure out how to integrate a lot of those cultural things. And one way of doing that is, first of all, building relationships with them and with the communities. And sometimes it literally means immersing yourself. It's a little bit easier for me, having grown up on the reservation and traveled to a lot of these, you know, and knowing a lot of the people at the same ceremonies and all. But again, a lot of it is building those relationships. That's the first part of it. And hearing from them what the impacts really are, what they're concerned about, but then also what components of culture they want to look at, because just like climate change, there's many layers of culture, you know, the actual practices that we carry out, but also emotional, cultural way of being and all those different things. And so we basically listen to them and take their input and then try to incorporate it into our different management plans and things. And so one good example is our vulnerability assessment with the scientists that are running the tools, looking at, you know, what species are more vulnerable. I'm actually hearing it from those who are out there on the ground hunting, fishing, and gathering and everything, the changes that they're seeing, and then we incorporate that in. And sometimes, you know, the two match up and sometimes they don't, but what's important is we hold space for that and talk about why we're doing this work in the first place, which is the culture, which is our people, and it needs to stay grounded in that. But we're definitely learning how as we go, because a lot of it is like intertwining and sometimes the two don't mesh. Cultural lens really can't, it can't be put up against something that is from, in some ways, a foreign perspective for us. And so it's a learning process, but I definitely will share some different resources that we've, you know, come up with and things, and so that it can be shared with everybody too.
Yeah, thank you, Melanie. You know, I think that's a really, you know, important and pertinent point that you bring up about the different individuals, you know, especially when we do health research, there's so much about disparities, and we oftentimes, you know, learn that these disparities are linked to different cultures and different ways that people use the land and use the resources around them. Even if you live in the same community, that can drive stark disparities between individuals, even within small areas. So that's a really good point that you bring up about the culture and the way people use resources. So our next question is for Dr. Kim, and it said, your layout of the process is admirable. However, in a deglobalizing world, it seems we're seeing greater difficulties in getting nations to work together. So how do we move this agenda forward on a global scale?
Sure. So yeah, that's a really good question. So by working at the WHO, I clearly see that you know, hard to work together for the developed countries, but not for developing countries. So basically, UNFCCC, those are the UN Convention for Climate Change, UNFCCC.
UN Convention on Climate Change.
Yeah, thank you. So, you know, they already developed all the agenda and guidance what to do for the building resilience in developing countries. But it's hard to really force to developed countries like United States and many European countries and Japan, Korea. You know, those countries are donor countries and they have their own agenda. But so developing countries, we work together at the regional level. For example, WHO has the 6 different regions, and we always approach one single country at the local level first. From, you know, that's the bottom of the approach we do. So we understand the local level problems, you know, do the vulnerability and adaptation assessment, and then understand all the risks they have, and then move up to the national level. And then we use that single country experience to the neighbor countries in the region. So developing countries, we do a lot of you know, collaboration, and then lessons learned, and all the, sharing all the knowledges and everything. And also another funding mechanisms is GEF, Green Environment Facilities, before GCF. So that's under the UNEP, UNEP. And UNEP already started the regional climate change resilience building projects in many regions. One was in Asian countries, 6 Asian countries all together, building the climate resilience. And I was the project coordinator for that. So we shared a lot of information and the building resilience together. However, it's very difficult. Again, maybe European countries, they have unions, so they communicate, but United States has own agenda. And especially the politics is very important. Depending on who are the president, the direction can be totally different. So before the president, the previous president, we had no agenda for climate change. We could not even use the climate change word when we write the proposal. So in my case, I had to use climate alteration or environmental change in order to get around that term, just filtered project. Now it's a different word. So hopefully, our current president can communicate with many other developed countries and building alliance. Good thing is COP, COP26. That I think that's the last year. That's the good place to start, the collaboration among the other countries. But anyway, the point is, developing countries, they really follow UNFCCC guidelines, and WHO work really hard to build the regional resilience, but not for donor countries. Yeah, that's the reality.
Yeah, I was just gonna jump in and add to that. It's because the global South or developing countries there is a disproportionate impact from climate change on a lot of those countries because they are poorer, because of their vulnerabilities. Often adaptation is sort of the lost child for the developed countries, and there isn't enough consideration of how adaptation plays out in a developed country context. So even if you think about in the United States, in the wake of Katrina, in the wake of Sandy, right, there's this disconnect in terms of how some of the developed countries approach adaptation, and they might have plans, but as Dr. Kim said, there tends to be less collaboration across developed countries on those issues. For developing countries, I think from a number of different spaces, there are lots of different platforms for South-South collaboration. So whether it's the sort of the regional climate hubs that have been created through the Global Environment Facility or the Green Climate Fund, or there's an East African community that comes together to talk about a variety of different things. There's a West African community, then there's the African Union, there's all the various Asian regional groupings that come together, and also add, from a legal standpoint, add also riparian agreements about river systems and water systems that can also be a place where the health angle can come in, right, in terms of how we're managing our waterways that flow across multiple countries. I think the fact that those platforms exist does lend itself to greater collaboration between developing countries. I think the challenge, though, is the interdisciplinary nature of climate change, right? You can have a conversation of climate and health over here, right? But if you don't consider livelihoods, agriculture, transport, and energy systems to keep healthcare systems afloat, then you sort of don't have the full picture. And I think that's where, even for developing countries, the challenge comes in is how do you create the spaces to bring all of the different sectors together in a way that doesn't completely overwhelm everyone and just lead to this race to it just becomes a depressing conversation. So that's part of the challenge in the expert dialogues I've engaged in, is finding the way to sort of build the interdisciplinary piece of it in.
But let me add a little bit more on that. So, I totally agree with that. And the disconnection between, among those sectors, different sectors, is a big problem. For example, when I try to implement the climate-informed early warning system, the key data is weather data. And health sector doesn't own that data. It always did under the Ministry of Environment or Mass Service. They don't share and we have to pay for the data. And those data usually delay a lot, like every quarter. You need a daily or weekly data information to project the outbreak. And there's a real-time data available, but they don't share it because it's like developing countries, they need money. So what we really do is we really highlight the co-benefit between the sectors. So we really explain that by doing this work, you're gonna get the co-benefit too. And the key thing is the funding, as Niranjali just mentioned. Without funding, people don't move. That's why I spent a lot of time on developing projects from the GCF and also GEF to bring the money. Otherwise, policy assessment, whatever, they are meaningless without climate finance.
Great, thank you for that. So I think that's another nice segue into another speaker's comment when we're kind of talking about adaptation and specific examples. So they write, "It's wonderful that we continue to make headway with assessment and mitigation or adaptation plans. And there is no shortage of understanding about the impacts and solutions for climate change and health. But we are much further behind in mobilizing the political will to act on this knowledge. So for each of the speakers, can you say more about hopeful or maybe promising work in terms of movement building or power shifting so that we can get the acceleration we need to make meaningful change and avoid the most catastrophic scenarios?"
I can start with that. It's interesting listening to all these different components, and I have to reflect on one piece of it a little bit, is the fact when it comes to climate change and adaptation plans and assessments and working with governments and things, as we know, all those things move extremely slowly. All of it takes a lot of time. But in the meantime, climate change is the crisis. Climate change is now. And I'll give one example. In a nearby community, Bad River, which is also at the very top of Wisconsin here, they got hit with two, like, I could be a little bit wrong about this, but two 500-year storms within like 2 years or something like that. But basically what had happened was the storms that came were completely devastating, washed out like huge sections of highways and main highways going through. And so it wasn't, when that all happened, it wasn't just a roads problem. It wasn't water and sewer. It wasn't natural resources, the fact that sugar bushes were washed out, and it wasn't a fish problem and all those things, but it was all those problems at once and then some. And one of the things that had happened was we literally had tribal members that were isolated at their homes with no access to them, no way to get out, and they were dialysis patients. So helicopters had to come in and actually, get them to their dialysis appointments. And when you think about like doing adaptation and working with government agencies and stuff like that, we don't have time for that. The time is now. Our people are suffering every single day on so many different layers. But of course, in the meantime, that can't stop us from doing a lot of that work, but we have to almost function as if we're in crisis mode. And also the fact when it comes to a lot of our people in our regions with, reservations and ceded territory and things, if the option is posed to us for relocation, or if we're told we have to relocate, that changes the entire game for us and changes our entire lifeways, because our lifeways are dependent on these regions, these boundaries that we were literally forced upon. So if we're moved away from, say, deer, for example, we can no longer hunt those deer or carry out our ceremonies with them, or, feed our children with them. Then we lose like a huge part of our survival, a huge part of our identity and things. And so in saying that, all of those things are going on, but simultaneously we have to make the efforts to build those relationships with different government entities and get them to listen and get them to enact policies and bring in funding and all of that. And so one way that we do it as tribal people is we have our own, forms of government, often called tribal councils. So a lot of our issues are brought to them, and our tribes do pretty good about making sure that those concerns and those voices are carried up, to the national and sometimes international levels. And so we can't think about these issues or talk about them just within our own yards, even though that's extremely important. But we also have to bring them up, these real life examples, like, you know, show the pictures and talk about the stories of those old people that weren't able to get to dialysis because there was no way in or out. And this is the severity of it. And let them know, like, this could have been your mother, this could have been your sister, whatever it may be. And so that they can relate on that level, because a lot of times the government people just function, you know, so far away from the grounded issues where if it's not put in front of their face, they don't really see that. And I know there's been the fear, there's a taboo about using terms like climate change and things like that. And so we've went through the same thing, and we've had to talk about changes in the environment over time. But at the end of the day, it's reality. I mean, it's happening. We're an adaptive people. We always have been. But the changes are happening at a rate that's heavily impacting us on every level. And so we often, not just at the tribal council level, but our people serve on different committees, like the one with Wisconsin with the Great Lakes Commission. I was appointed to that. And so I'm able to actually bring some of the concerns of our local people to that state level, and then each state, you know, works on the national level with the Great Lakes Compact Commission issues and things. And so a lot of it is getting our own people out there, even if there's people like me who don't have, you know, haven't had the opportunity to get PhDs at a young age and things, because I was having family and all of that kind of stuff. But our voices need to be out there, even if we don't talk like the fancy governmental talk or the funding talk or whatever it may be, but they have to hear how it really is for us. And we do that by trying to get our people in those type of positions on various committees and things, or just literally busting down doors, which some of our Native people have done throughout time. Like, hey, you're going to listen and you're going to hear what it's really like for us, because we need to survive as a people. So hope that kind of answers it in a long roundabout way.
Great, thanks. Oh, go on, Niranjali.
I can come in. It's hard. It's really hard to maintain hope when you see the lack of political will from countries, and some of that across the board. A lot of my frustration in the work I do does come from the fact that developed countries, the contributor countries, aren't prepared to put the kind of money that you need on the table. But then you also see inertia in some of the big developing countries as well. So there is that across the board. But there are some things. There are some things that I ground in when I look at how the landscape of even climate finance has changed in the last 10, 15 years. One is that there's a much greater acceptance in the funding community of the importance of capacity building, which I think is critical. It's often overlooked, but we need to make sure that government at central level, but also at local level, right, that there's capacity building for people to actually do the work. Assessments, yes, but then to actually carry out the solutions that need to happen, because in a lot of situations, these are not one-off solutions, right? They're ongoing solutions that require consistent investments in capacity of people and expertise, knowledge, et cetera, and sort of learning from what you're doing and continuously adapting, as Melanie was talking about, right? And that needs resourcing. So there's a greater understanding of that and a greater desire to put money into those places than there might have been, say, 10 years ago. The second is that it used to be that in the climate finance world, the contributor countries would keep saying, there is money that we can move, but we don't, where are the projects, right? Where are these, great concepts and things that we can fund? And for a long time in the activism community, we were saying they exist. You're not willing to put money in the things that developing countries want to do, right? And we've been pushing for ownership from developing countries and ideally locally led solutions. And there's been this mismatch. But now when you look at the Global Environment Facility, when you look at the Green Climate Fund, they have billions of dollars worth of concepts and projects that they've received that now there's no funding for. So that excuse no longer holds, right? And it's a weird example, but it gives hope, because now we can go to the contributors and say, actually, no, if you were serious, here are the projects that you can put the money to. The third thing is that as compared with 10 years ago, one of the myths we've tried to bust in the work on, especially related to adaptation, is the idea that everything is centralized. Like everything has to be a centralized solution. We need these big infrastructure-based solutions for adaptation. And that might be one small part of what is needed if you really need to do some major infrastructure changes to deal with some health issues or adaptation issues. But the vast majority of positive examples we've seen have been from a locally led standpoint, right? It's not just some massive central thing. It's when you're able to take local solutions. And when we talk about scale, it's not just then, okay, everybody uses that, but you scale the approach, you scale the process, because it might give you slightly different solutions across different communities. But if you're using that and saying centrally, we agree, this is sort of the process we should use, then you have more positive results. And we actually have the proof of that now, because we have the projects that we were trying to pilot 10, 15 years ago, and we have the data to back up the fact that this has actually worked for communities. So that gives me hope, because it's changing the narrative about, oh, it has to be this big central infrastructure-based solution on adaptation. And the last thing, which is a little bit of a roundabout example, because the starting point of this is a little bit depressing, that when I look at the United States, and even with an administration that says it's committed to addressing climate change, the requests coming from the president's office, right, on international climate action was what, a total of 11 billion, and about half of that was grants and the rest of that was loans. You compare that with the $778 billion that they're requesting, or actually more than that, close to 800 billion for defense, right? And the thing is, that is depressing, but the story that I like to tell about it is like, where the government wants to prioritize, they can raise the billions, right? Germany raised 100 billion over a weekend to deal with the Ukraine situation. So the ability to raise the money is there, but we need the outside pressure. There was so much outside pressure building with movements, and especially youth movements coming in before the pandemic. And then with the pandemic, we lost some of that momentum. So my hope is that as things start to open up again, we can reignite some of that mobilization, because if people are shouting loud enough, I do think that at a certain point, governments can't ignore it. And the capacity to raise the money is there. The argument that we just don't have the money doesn't hold anymore, because governments have shown in the last 2 years how much money they can raise to deal with the crisis that they care about.
Great, thank you, Niranjali. Dr. Kim, did you want to say anything about any examples of hopeful or promising work that you've seen in terms of movement building or power shifting?
Yeah, sure. So I actually have a lot of interesting stories on the adaptation, like urbanization in Mongolia due to destabilization of the polar vortex, extreme cold. Unlike other countries, they experience extreme cold because of global warming. That's kind of paradox, but because of that, a lot of nomad population, they lose their livestock and no money, so they move into Ulaanbaatar. Now it's the 60% of entire city population is the newcomers there, totally unaware impact of climate change, urbanization, unplanned displacement from the extreme cold. How about the mental health? Like Kiribati, they have very nice correlation between increased temperature and mental health incidence prevalence. That's what I gathered the data and did the analysis. Is mental health is the climate change impact? Should we prepare for mental health infrastructure as an adaptation measure? Like Kiribati, they don't have any psychiatrist. Only 4 nurses trained 3 months for the mental health, and they do all the mental health related work. And how about the Tuvalu? Tuvalu is one of the poorest country in the world. And when I visit there, I found most of the people, they are like a double size than me. I'm quite big too. So I went to a customs office, see what kind of materials, goods they import. Number one is the construction materials, because they have a lot of ODA money to do a climate change adaptation, like constructing seawalls, because they are only like 3 meters higher than sea level. That's the highest land in the country and really vulnerable to climate change and hurricanes and also king tide. That's what they call it, almost cover entire islands. So the first adaptation work was constructing seawalls around the island. And then the money comes in to the local population, for the labor for construction. They never had the money before, but suddenly they got the money. So they start to use the money for the second imported goods was sugary beverage. Number one is construction materials. Second, sugary beverage. And now they are suffering from the obesity-related disease. Almost half of the people population, they die from diabetes, hypertension, or obesity-related. That's the paradox of climate finance, very siloed policy. They didn't really think about other side effects, just to put a lot of money there and didn't really care about others, impact. So there are many different types of adaptation, but what I really think, there's a hope. As Niranjali mentioned, the government people, they usually don't care, but good thing is Green Climate Fund, they have different types of proposals. And the first stage is always the readiness. Readiness mostly targeting the capacity building of the government people. So they assigned the nationally authorized NDA, nationally designated authority. That's usually Ministry of Environment, the ministers. And they train them and educate them with the funding. So that's the first step. So government, they fully aware about their problems. And then next one is the project preparation. So I understand, like 10 years ago, there's huge problems in GCF. They collected all the money, never spent. And there's a lot of internal problems too. Director had the issues. And so recently they changed a lot. I think that's another big hope. The United Nations, they start spend the money for developing countries. This is not for comparative funding. This is really designated for each country. And each country, they don't have a capacity like us to develop the project. And we really work together now through the World Health Organization or any other like UK aid and ActionAid. I believe you also work on the GCF and many different NGOs and international agencies working together to bring very nice projects for those countries. And money is moving now. Because of the COVID-19, there is some pending, but I have a lot of hope. And we already know a lot of the risks, different risks and very unique risks by the countries. So that's a lot, that's enough evidence. And another different thing is we try to apply our common science, normal science to climate change area. Collecting the data and try to find some association and collect the scientific evidence. I think climate change is really projecting the future, not the observational area. So without even without the enough scientific evidence, we should move. That's the precautionary principle approach too. And we don't want to wait until getting all the scientific evidence to act. We should act now unless there's evidence that our action is totally wrong. That's the precautionary principle we should apply to climate change area. It's really different from the traditional epidemiological approach. And so I think the hope is that we don't want to wait for the scientific evidence, collecting all the scientific evidence, but we can move and money is there. And there's a coalition, international coalition to work together to help the countries. So that's my hope.
Great, thank you very much, Hyun. So I know a bold statement to tell a group of scientists to not gather all the evidence. We have just a couple minutes left before the session ends. So we have one final question, and I'm hoping each of the speakers can take just a minute or so to give their thoughts. So one of the participants asked, from your lens, what are the highest priorities to focus on for specific solutions? So I know that's a broad question, but I'm hoping that each speaker can maybe choose one thing that they would prioritize and just explain really quickly why. So Melanie, would you mind kicking us off?
Sure, that is a huge question, a really broad one and loaded, but like so important because I think that's something that we should keep in our mind like every day as we move forward so that we don't lose focus of what's important, not just to us, but for the people that we're working for, the people we're trying to help and things like that. I guess for me, if I like could pick and choose, I would say spiritual, but also emotional health because that's kind of at its core because when it obviously we have to eat and all those different type of things, but when it comes to emotional and spiritual health, if we're not feeling good in that sense, we can't really get up and out there to even address all these other layers of issues that are before us. And it's really hard when you go back to things like that dialysis patient or the group of them that actually was being impacted. They were so dependent on that dialysis, but when we've talked to them afterwards, what was really impacting them or what was going through their minds at the time, they were thinking about if they were going to be able to go to a ceremony again. They were thinking about when they would be able to go out and put out their tobacco again. They were thinking about how their grandchildren would be if they were to pass away and not make it through this. And a lot of that, is emotional and spiritual. Even though they're extremely worried about their ultimate survival if they don't get that dialysis, that was kind of at the core of it because, they talk about what's so important with us is we're humans here on this earth, but we're just really spirits that are coming into our human vessels, having this human experience while we're here. So in essence, like a lot of it at its core is that emotional and spiritual well-being. So if we're not feeling good in that way, we can't really move on. So again, if I could pick and choose, that's kind of where I would start or try to always focus on those type of areas. But it's hard. Climate change is such a complex issue and it takes all sorts of different people to look at the issues. It takes all these people that are doing the years of research, the qualified scientists, the people with big degrees, but it also takes the locals too. And we have to come at it together from a collective approach and all sit in the same room together because really it's all affecting us in different ways and it's here. So that's, kind of where I think about.
Great. Thanks, Melanie. Niranjali, do you want to give your thoughts?
Sure. I'd say if I'm thinking about the intersection of climate adaptation and health, and given the food price crisis we're seeing right now, I would say it's food systems and really rethinking the existing assumptions around industrial agriculture and shifting to more sustainable approaches like agroecology, and focusing more on local and smallholder farmers. I think that's where, both from an adaptation and a nutrition standpoint, we're going to see more positive outcomes for people and the planet.
Thank you. And Hyun?
Sure. I think the most important thing at this stage is science and technologies. I've been talking about the funding, policy, and adaptation, but science and technology, I think that's the key. So there are steps for the climate, resilience building. First thing is forecasting climate impact and assessing vulnerability. Second is projecting disease burden. And third thing is assessing the public health intervention. Four, that's the implementation. I think this is a stage now. We developed a lot of projects and did a lot of assessment, vulnerability assessment, and we know what's the problem they have, and we know what kind of gap they have, and now is the time to implement to fix the problem. And Jesse just make a joke I said don't do science to a bunch of scientists. No, what I'm saying is proving the association, that's probably enough. But moving on to solution. So scientists can do this job. Engineers, they have tangible solutions like water. Water is a big problem everywhere from the climate change. What is the most sustainable and affordable water technology people can use without paying money? We have solution already. Just we didn't apply that to climate change world. So I think the most important thing is just look at the technology science we already built and see how they can be applied to the many vulnerable areas and countries and affordable way and also sustainable way. Sustainability means sometimes local production and management by themselves. Not we go there and put some water treatment system and after 1 year that doesn't work. I see that everywhere. We really train the local and using the local material and then make them manage the system for a long time. That's the science and technology. That's our job. And I'm not saying, epidemiology or, proving the association is bad, but climate change has a little different agenda. So that's what I'm trying to say. So now I think this is a time really we focus on the interventions.
Great. Well, we are just at about 10:30, so we're at time for the session. On that note, I really want to thank our three speakers today for being so generous with your time, with your thoughts, with your perspectives. It's so valuable to hear from all three of you, learning about climate change from this very large international level to the national level to the very small local effects. All of them are so important to really understand, as you all kept reiterating, this very complex but very important really climate health issue that all of us will be affected by now in the future. So a round of applause to all three of you. Thank you again. And I want to thank all of our participants for being so generous with your questions and giving your thoughts. A word of note that you will all be receiving a survey via email to just get your thoughts on the panel. I know that Health Equities Working Group always tries to improve these in the future, and your thoughts will be useful for helping that. And a recording of this session will be posted at the UMN YouTube website in a couple days' time. So thank you again to the speakers, and thanks for all of you for participating.
Thank you.
Thank you. And thanks for helping to bring voice to climate change and all these layers of concerns.
Thank you.